So hey guys, welcome once again to the 127th episode of Painacea Pain Talks. And I'm very excited to see you all here today on this Sunday morning. And we're going to discuss a very important topic today, which is going to change the lives of lot of patients who are suffering from the chronic pain. So today we're going to discuss how can ultrasound help pain patients, and we're going to take a lot of exciting stuff on board. Just allow me to share my screen, and we will begin now. So I hope you all can see my screen now. Just type uh, in the chat box, yes, if you can see the screen, and we will begin. So ultrasound can help pain patients in many ways, and since this talk is supposed to be for the patients, I'll try to keep things very simple. So ultrasound is something which has been around for like ages now, but we are discovering new and new uses of ultrasound, and recently it has gained very wide popularity for treating the patients who are suffering from pain, and how this talk will detail all that. So as I mentioned, this is not something new. So the principle of the ultrasound is that there is a probe like this. This is known as a probe, with the help of which we send the ultrasound, which are sound waves, which we cannot hear, but which have the properties to travel through solids, liquids, and gases, and they are then received back. So this is sent to the tissues, and then it is received back, and it is shown on a screen where we then interpret this. So how can it help back patients? I'm not talking about the ultrasound which probably a physiotherapist will use, because the purpose of that ultrasound is to generate heat, and that's it. And we are talking about ultrasound as a modality for the actual treatment of the disease process. And also it starts with the diagnosis. So once we are able to see something which is there, which our eyes cannot see, so it gives us a lot of clarity on the patient's disease condition. So when the patient comes to us, and we start asking them questions about how it pains, when it pains, and they tell us, okay, it pains on my back and all that, and we make a diagnosis. And that diagnosis is only a presumptive diagnosis, and which can be then verified by various investigations, and ultrasound is going to give us that kind of power. And as a result, it is a very good diagnostic aid. So I can do the ultrasound of my patient and find out what's the problem with the patient. So this is a very big plus. There are experts who are known as radiologists, the expert doctors who specialize in the diagnosis. That's why the branch is called as radio diagnosis. So they help us to diagnose, but now the ultrasound is gaining so much popularity that the concept of bedside ultrasound, that is, the patient comes to me, I just make a clinical diagnosis, I just keep the ultrasound and make the presumptive diagnosis. I convert it into the final diagnosis. And if I need any assistance, of course, my radiologist colleague is there to help me in making the diagnosis more precise. So in addition, there is something which is known as a dynamic scan, which is a very big plus, because this is available only in ultrasound. What is it? So when we tell a patient to do any investigations or any test, and most of them are static. That means, for example, patient wants to get an X-ray done, he stands, X-rays are thrown, we get the image, and that is a kind of a snapshot, a picture of the patient at that particular time. Similarly, if I tell the patient to do a CT scan, it's the same. Similarly, if I go and tell him to do an MRI, it's the same. In fact, they tell you do not move while the MRI is being performed. On the other hand, in ultrasound, we have this capacity and capability to do a dynamic scanning. Means we keep the ultrasound on the patient's body part and then we tell them move that body part and tell us when it pains. Okay. And we kind of correlate that to the symptoms of the patient, and then we can probably reach to the cause of diagnosis. This is extremely important in conditions where movement causes pain. So patient tells, oh, I have no pain at rest, doctor, but as soon as I start to move, and especially true for younger people with pain. So if you are young and you have pain and your doctor tells you, okay, get an MRI done, and you get a normal MRI or normal scan or normal, there's nothing which is abnormal. So this may help us to diagnose this problem. Maybe there is a snap, maybe there is, some abnormality while you move, which is shown clearly. Maybe the painful structure is delineated better when we are doing this scan, and that can help us to a very great extent. Okay. Now, it also is a therapeutic aid. That means that once we have made a diagnosis using the scanning, we can also make the treatment option. For example, rather than giving a blind injection, in the front of your screen is a knee joint. So rather than giving a blind injection there, we can actually use this to give a guided injection under real-time ultrasound guidance, which makes the treatment immediate, accurate, and of course, the results are much, much better. It is said that it improves the results by as much as 50%. And it's a big, you almost 1 out of 2 patients will improve. So in addition, nowadays healthcare has become very expensive, and many times we have to liquidate our deposits, our investments just for our health. And ultrasound is a very, very cost-effective modality. It is super affordable, I would say, and as a result, this treatment option is not very expensive. The only thing is you need a trained person to do an ultrasound. Anybody can hold that probe and stand and see those grays. But the key here is to have an experienced person who is having enough training and enough experience in doing all these procedures safely. Okay. So many people call ultrasound as a new stethoscope, but I prefer to call it a new Swiss knife, which is there in the armamentarium of a spine and pain physician and many other doctors. Nowadays, cardiologists are using it every day. The gynecologists are using it every day. And more and more pain physicians are also using it every day. So there are many use cases for which the ultrasound can be extremely helpful tool, and one of them can be for spine pain. So we can not only diagnose, but we can also pinpoint the level where the pain is arising from, and in fact at the same time we can conduct a diagnostic procedure which can confirm some of the otherwise very difficult to diagnose treatment options, or the very difficult to diagnose modalities, or very difficult to diagnose illnesses like the facet joint pain. So it can be confirmed then and there. The diagnostic procedure can be performed at the clinic itself. The patient does not need to wait for the OT and go and pay for the expensive charges, but they can get it at a very reasonable and, as I mentioned, super affordable cost at the clinic, and then later on the definitive procedures can be performed. Similarly, for the knee pain, we can diagnose the knee. In fact, we can do a lot of dynamic scanning here, and it can be very helpful. After we have diagnosed, we can give a variety of treatment options to the patient, and immediately we can perform the procedure as well. Okay. In addition, for the shoulder pain, it's extremely important. Shoulder is a very uh, complicated joint, if the diagnostic modalities are not properly used, many things can be misdiagnosed. On the other hand, some of these treatment options make the life of the patient very easy, especially when done under image guidance or under ultrasound guidance, and that's going to be very helpful for the patients. Many people think that headaches are refractory and they cannot be treated well, but with the help of ultrasound, we can accurately give the diagnostic procedures by avoiding the structures which we want to avoid, and by reaching the structures which we want to reach under real-time guidance. So this is a very big plus, and I hope that this will be used more and more. We are regularly using at Painacea. We use it very regularly for the treatment of our headache patients. So this is another option. Going to a very difficult to treat pain, which is cancer pain. So unfortunately, in Mumbai, the awareness about the pain management, interventional pain management options amongst the cancer patient is very low. And especially if we consider the fact that Mumbai has the Tata Hospital, which is considered to be one of the pioneers. So more and more awareness is being created even amongst doctors. But let me tell you, most of you who are watching or who will watch this video will be non-medicos. So there are a lot of options available for cancer pain treatment, and this can be done with an ultrasound in the clinic, and this can have very good results for cancer pain patients who have refractory cancer pain. And also this will avoid your opioids, your cannabinoids, and lot many other medications which can have a variety of difficulties for the patients. So let me ask you one thing. Just type how much is 1 plus 1. So come on, guys, please type in the comments or in the chat box. How much is 1 plus 1? Very simple question. I think all of you know the answer, but I want you to type, and I will proceed thereafter. Okay, so I'm sure many of you would have typed 2. Some people must have typed 11. Some people must have not typed at all, but at least let me tell you that this 1 plus 1 is 11 when we combine this ultrasound with our other treatment modalities. For example, we can combine this with the cooled radiofrequency ablation procedures which we are doing, and we can also combine it with the cryoablation procedures which we do. And if you see this is the equipment with which we do the radiofrequency ablation of the nerves, and with the help of the ultrasound, we can greatly increase the we can retain the rather efficacy, but increase the acceptability of the technique, because it becomes quite easy for the patient as well as the doctor to perform this procedure if they are doing it with the ultrasound. Same thing is true with the cryoprobe. In fact, most of these procedures would be performed with ultrasound because of a distinct real-time feedback, and we can actually see the icicle forming, and that's a very, very big plus. So for the peripheral nerves, this is a kind of a, I would say not 1 plus 1, 11, but maybe 111 can also happen with this. The regenerative treatment is very popular nowadays. It is very successful in painful conditions, and also in many other non-painful conditions. You must have heard about platelet-rich plasma or stem cells, and also now we're using scaffolds. So all of these are very now accepted techniques, and these techniques can be even more effective if used with the ultrasound. So when we combine this with ultrasound, the results are going to be really very fast and very cost effective, super affordable, and the patient can take the advantage of these techniques, and also more accurate. So where we can do this for the facet joints, we can do this for the knee, we can do this for the or any joints, wherever we want, we can use this, and also we can use it in the muscles as well. And the results are, the recovery is super fast. There is zero or minimal cutting. It's actually only a needle prick, and it's also minimally invasive. Most ultrasound is non-invasive, so you can use it in anybody. And this results in a comfortable and meaningful life. And just imagine if the person has to do a procedure for which he's not worried about the cost. Even if he's required to repeat it, it's extremely easy for him to do that. And also there is no time involvement. All of these, patient gets immediately after the procedure, maybe after 1 or 2 hours, they are home. And as a result, it's very effective. In India, we cannot go to the patient's house and do this procedure because of the restrictions on the carrying of ultrasound machine or the equipment. But otherwise, in many other countries, even the physicians can go in the patient's house and do it then and there. So which also is a very big advantage. So now let me come to many of you must be hearing about all this for the first time. So the key here is delivering personalized care, which only a physician can deliver or rather, let me call a spine and pain physician can deliver for pain procedures. And it's kind of built into the branch that we have to analyze each patient individually. And since the treatment option is quite different in most patients, so we individualize this treatment. We perform various treatment. We offer various treatment options for our patients, and one of them is spinoscopy. Then we have the neuromodulation, which is available. I already told you about the use of ultrasound in various body parts. And instead of the patient going from one doctor to the other doctor and getting confused with the treatment, we also have at Painacea, we have got all these doctors available under one roof. We have a pain physician, physical therapist, psychologist, dietitians working as a team if required. So for all the patients will not require all the colleagues, but definitely many of the patients would, because usually the patients who come to us, they are having chronic painful conditions, and we evaluate them and give a holistic solution to all our patients. So guys, this was it for today. I'll be taking questions, of course. So whatever questions you all have, you can type in the comment box, and I will be very happy to answer all of them now or later as well. So we'll just take the questions as they come, and I will be very happy to answer them and immediately the questions suggest the solutions. And so it was nice talking to you all. See you around very soon. This was Painacea Pain Talk episode 127, and we have our past episodes available on our YouTube channel. Just YouTube Painacea, Painacea, or just Google it, and you will reach our Facebook channel, and we shall be very happy to answer any of the questions, queries, comments, suggestions. Everything is welcome, guys. We shall be very happy to just answer any of the questions, and we shall be happy to hear from you all. Happy Sunday. Bye bye.